How do GLP-1 agonists work? Are they safe? And are they right for you and your PMOS? Let's talk about it. I'm Dr. Kim Sommerville, your general practitioner and your clinical nutritionist. And today we're going to be talking about GLP-1s and PMOS and how they can work for you. Let's go. Now, GLP-1 agonists stands for glucagon-like peptide 1 receptor agonists. Now, it's a really big name, but essentially what it is that it is stimulating particular cells in the body that when your blood sugar is elevated after you've eaten something, it now stimulates the secretion of insulin. This is important because insulin allows for your sugar that is now in the blood to go into the cells that need it in order to provide energy for those cells. If your sugar is staying in your blood for long periods of time, then you're likely developing prediabetes or type 2 diabetes. And that's one of the reasons that this particular drug was initially used to help persons with type 2 diabetes control their blood sugar. Outside of increasing the insulin secretion and allowing for that sugar to get into the different cells, the GLP-1 agonists also delay how quickly the food leaves the stomach. So let's think about this. If the stomach is not empty as quickly, what happens is that the blood sugar doesn't spike as quickly and you're not as hungry as quickly, which of course would then lead to a reduction of appetite and a reduction of your food intake, which can then lead to having a reduction in your body weight. These two functions are pretty important when it comes to PMOS because, as we know, a very large percentage of women with PMOS will develop type 2 diabetes by the time that they're 40. As well as the fact that many women with PMOS are in the overweight and obese category. So it's kind of a win-win in terms of how GLP-1 agonists work. But what else can these medications do for women with PMOS? So some of the benefits of GLP-1 agonists include, of course, managing your type 2 diabetes, managing your weight in terms of allowing for weight loss, and other things as well, like improving fatty liver disease, reducing the incidence of heart disease, treating sleep apnea, as well as managing your cholesterol. Specifically for women with PCOS, studies have found that GLP-1 agonists provide a reduction in your waist circumference, so you're going to be losing that PCOS belly, reduction of your body mass index, so you're losing some weight there, and then it also reduces your triglycerides, which is essentially a type of bad cholesterol, as well as reducing your total testosterone. So this really seems that it has a lot of benefits for persons with PCOS because of the complications that this syndrome causes. When should you, as a woman with PCOS, start GLP-1 agonists? Well, usually with PMOS, you tend to have insulin resistance. So doctors or nutritionists might say, try some supplements, try diet, try exercise, and even try metformin. Now, if you're completely intolerant to metformin, or you have constantly tried diet and exercise for your weight management as well as your overall PCOS management, and you found that these really have not worked for you, then a GLP-1 agonist may be right for you. Always talk to your doctor before starting any medication, but these are some of the reasons you may decide to start taking a GLP-1. There are many different types of GLP-1s, but the two common ones that we're usually hearing about, especially the ones that have been studied along with PMOS, is semaglutide, also known as Ozempic, which is mainly for type 2 diabetics, and Wegovy, which is mainly for weight management. You also have tirzepatide, which is a little bit a step above just a GLP-1. It's also a GIP agonist, and its brands are Mounjaro, which is mainly for type 2 diabetics, and Zepbound, which is mainly for weight management. Now let's talk about the safety of GLP-1s. This is one of the main things that we've been hearing about, the fact that yes, It works to do what it wants you to do, but what are the side effects and can you manage them? So the main side effects you get with GLP-1s is gastrointestinal, which really means problems with the stomach, the intestines, all that type of thing. And of course, it makes sense because GLP-1s work specifically on the areas of your stomach and your intestines to manage your blood sugar and to reduce your appetite. So some of the GI side effects include feeling nauseous, vomiting, having diarrhea, even constipation, belching, bloating, flatulence, which is also passing gas. And it's really noticed when you start increasing the dosage of your GLP-1. Typically what happens is that you start with the lowest dose, continue that for 1 month, and then slowly increase to different dosages dependent on your blood sugar control or your weight management. So some of the ways that you can manage these GLP-1 side effects is trying to slow down how quickly you increase your dosage. Of course, that's between you and your doctor, but talk about that for sure. Also, when it comes to you specifically, try only eating when you're hungry. This is beneficial because when you eat when you're hungry, then the medication has time to act on the food and not acting when you're not actually hungry. Your stomach is ready for food, hence the GLP-1 agonist will help during that time. Eat slowly. Remember, what this drug does is slow down how quickly your stomach empties. So if your stomach is not emptying as regularly or as fast, then eating too fast may make you feel nauseous. It may make you vomit. So we want to slow down our eating. One of the things you can do is try and eat in a relaxed setting and chew at least 20 to 30 times. It sounds like a lot, but if you practice it, it will definitely slow down your eating. And another thing is to actually stop eating when you're full. Try not to do the whole, I'm going to finish everything that's on my plate. Remember now that your stomach is essentially slowly emptying itself, so it doesn't have as much space as you would think it does. So stopping when you are full will definitely help with these GI side effects. Some more things that you can do when it comes to reducing the GI side effects is making sure that you're eating smaller meals. Making the meals smaller and more frequent will reduce the pressure or the impact that that food will have on your stomach. You can also ensure that you're hydrated. So drink about 6 to 8 cups of fluid or water for the day so that that will help your stomach and your intestines move along the digested food pretty easily. Lowering the amount of fat and spicy foods will also make a difference, because the more fat and the more spice in your food is the more that it's going to stimulate the gastric acid or the stomach acid, and more stomach acid will mean more nausea and possible vomiting as well. And also try and having a small walk after your meal. Even though your stomach is slowly emptying, walking will actually help your intestines move a little bit more and avoid having a lot of bloating and belching, and possibly allow for you to be a little bit more comfortable after you've had your meal. The other common side effect is muscle loss. So yes, it is beneficial if you are overweight and obese and you're losing weight, but we have to remember that when we're losing weight, we don't typically just lose fat, we may lose muscle as well. To prevent muscle loss, you have to speak to your nutritionist or your doctor and talk about specifically how much protein you should be having. It's very easy to not get enough protein because you're eating much less than before. Especially if your diet was predominantly fat and carbohydrates, you may not have concentrated on protein before, but trust me, having enough protein will definitely help. I have a video about how much protein you need. You can check my YouTube channel or just click the link in my description, and you can see how much protein you specifically need based on your weight, your height, your activity level. Muscle loss will definitely affect you because the more muscle you lose is the slower your metabolism will be. So eventually, if you stop using a GLP-1 agonist, you may find that your metabolism is even worse than when you started. So you may be gaining back weight even though you have had benefits from it when you are. Some other side effects include hair loss. What tends to happen similarly to muscle loss is that you are rapidly losing weight, and when you're losing weight, you find that protein and nutrients that should be going to your hair tends to go to other parts of the body. So you may find that you're having a little bit of hair loss. However, this is not permanent. It tends to grow back in the next 3 to 6 months. But just be aware of that. Two very important side effects, even though they're rare, are acute pancreatitis as well as sudden vision loss. Now, if you have acute pancreatitis, you may find that you have severe, persistent abdominal pain that sometimes radiates to the back, and it can also be associated with nausea or vomiting. If you do experience this, please seek medical attention immediately and stop the GLP-1s. Also, if you experience sudden vision loss, I want to say sudden painless vision loss, please, again, seek medical attention pretty quickly and stop your GLP-1s, because there's nothing exactly that we can do to stop this side effect, and we don't know who will actually develop these side effects. They're pretty rare, so not necessarily something to be concerned about, but it is important to know about it. So what do you think? GLP-1s sound pretty good to manage your blood sugar as well as weight management. It's even found that older weight loss medications tend to give you about 3 to 10% of weight loss, whereas GLP-1s can give you anywhere from 15 to 22%. Remember, when they're usually talking about weight loss for PMOS, it's usually saying that 10% weight loss is pretty good to manage these complications. What I didn't speak about is the fact that besides having weight management, you will more than likely notice reduction in other complications of PMOS. Once it is reducing your total testosterone, you'll find that probably your acne is improved, your hirsutism or excess hair growth improves, and if you're reducing your overall BMI, you might find that insulin resistance is lowered and your periods become more regular, ovulating more regular. I've even had some clients who said that they have previously used GLP-1 agonists and found that they got pregnant pretty quickly once they were trying because ovulation started back. So if this sounds like something that you would like to think about or even speak to your doctor about, consider GLP-1. It's not necessarily a lifelong medication if you're just using it for weight management, but it may be something that you use continuously for someone with type 2 diabetes. Thank you so much for watching today's video. I'm Dr. Kim Sommerville for Simple Summer Naturals, and I hope you have a wonderful day. Take care.